And it is my real pleasure to introduce a friend and colleague who has, if you don't know Ashish, I think you maybe have given up on television or have picked a different screen to spend your time with over this past year. But Dr. Jha is speaking today on the pandemic response, and he has recently become the dean at the Brown University School of Public Health. He is an American health scholar, the K.T. Lee Professor of Global Health, Harvard. Oh, that's the old one. He used to be the professor at Harvard. Sorry, Ashish. But importantly, he is has always been an amazing thought leader and researcher and commentator for American healthcare and health policy and quality. But he has really led the way this past year in disentangling what is data, what is evidence, what is fact, and what is not, and helping us to understand how we as a country and as individuals can navigate this pandemic. His full bio is, of course, on the website. And with that, I'm delighted to welcome our friend and colleague, Dr. Jha.
Thank you, Lisa, for a very kind introduction, and good morning, everybody. Thank you for being part of this. I am super excited to speak to all of you in this discussion, and I'm not going to use slides. What I'm going to do over the next 25 minutes or so is lay out a few issues really at the heart of the scientific enterprise, at the heart of taking science, generating science, disseminating science, implementing science, and use this pandemic as a framework to understand some of these issues. And my hope is in these 25 minutes, I can highlight and really bring forth some of the issues that I think a lot of us have probably been thinking about. And then in the discussion that will follow, we'll fill in gaps of things I probably should have covered but didn't, or address ways that we can move forward. And what I will say is that there are no easy answers to the questions that I'm going to try to raise, but we have to confront them and we have to deal with them because a certain set of things have not gone very well. Certain set of things have gone very, very well in this pandemic, but many things have not. And it is worth taking a moment to understand and reflect on that. So let's talk about the pandemic. Here we are, December 15th, yesterday, we crossed the mark of 300,000 Americans having perished from this disease. And the truth is that almost surely in the next 4 or 5 weeks, an additional 100,000 Americans are going to die. So while yesterday was a glorious day in terms of the vaccine and the first American getting vaccinated outside of a clinical trial, so much of everything else has gone wrong. And where I want to start is back in January. And I want to start with something I wrote that I got pretty horribly wrong. And I want to use it as a framework for what I understood about the world, and then really lay out what I have come to learn about the world. So in late January, I wrote a piece in a journal, Health Affairs, the leading health policy journal in our nation, in the US, about this pandemic, about the coming pandemic. And what I said, and it's in some ways kind of ironic and almost embarrassing to say it, but I'll share it with you, and it's available. You can find it on the Health Affairs website. But what I wrote was that while this pandemic was going to pose a serious challenge for the world, which of course it has, that the US would escape it largely unscathed. So that sure, we would have some challenges, but we would not be hit hard. And the reason we would not be hit hard is we had a great scientific enterprise in our country. We had the best public health agency in the world, in the CDC. And combination of great science and great public health means that you can manage your way through a pandemic. And obviously, 11 months later, looking at 300,000 people having died, 16.5 million people infected, many, many things have gone horribly wrong. It is not a single thing that has gone horribly wrong. And so what I want to do is talk about kind of the mental model I had in January, and then how things have shifted over the last 11 months, and what that lens tells us about dissemination and implementation. So let's go back to January or go back to 2019 and think about the mental model. I talked about a scientific enterprise, and then I talked about a public health enterprise as the features of the American response that were going to get the American people through it. So the scientific enterprise, which is robust, and if you have any questions about whether it is robust, you can just look at what has happened with a vaccine developed in very short order. It is incredible what the scientific enterprise can accomplish. But some interesting things happened along the way this year. And I think the scientific enterprise has largely kept, so my kind of vision of a fabulous scientific enterprise has largely held true. I think that's the one pillar that has done a good job. But even there's some really interesting challenges that came up that I want to highlight. So the mental model I had as a researcher who's written more papers than I care to count, is that, I do the research, with my team, we do the analysis, we write it up, we submit it to a journal, it hopefully gets reviewed, and more often than not, it gets rejected, and then you go to another journal, and you find your way until you find a paper lands in a journal where it is mutually interesting. And that process can take a long time. And that process is good. It has a lot of upsides. It has benefits. I mean, as a researcher, of course, it's painful too. But what it does is it matches papers to journal interests. It gets the papers well vetted, and it makes it much less likely that you're going to publish something that's junk or it's wrong because it'll have gone through multiple rounds of review. One of the innovations of this year, and it's a good innovation, but it's got problems, is the innovation around preprints. Preprints is a way to get information out much faster. And there are a huge set of upsides, because if you think about how quickly this pandemic has moved, if we had used that standard process, it would take us months to get any single paper out. Science moves by building on other science. And so the preprint revolution that has been enabled, it had started before this pandemic, but the way it has exploded in this pandemic, I think is largely good. But I hope you hear a little hesitation in my voice because it's complicated. So if you try to do some basic numbers, there have been, we think, about 75,000 or so papers put in preprint around SARS-CoV-2. The New England Journal alone says they've gotten 30,000 submissions for papers around SARS. So SARS-CoV-2, that's the virus that causes COVID-19. The point is, there's just been an explosion of data and analysis. 75,000 papers into preprints means, and all of these are by definition not vetted, means that you're going to start getting some terrific things that will land in Science and Nature and New England Journal and JAMA and Health Affairs and all the kind of prominent journals. But you're also going to start getting things that are nonsense, that are not correct, that would never survive peer review. And the most striking example of this is a paper that was put on a preprint on January 30th. And I'm just going to read the title of it, because you don't even have to read the paper to understand what its impact might have been. So the title of the paper is Uncanny Similarity of Unique Inserts in the 2019 nCoV virus spike protein to HIV-1, GP120, and GAG. What's the point of that? This was a preprint done by a group of researchers at IIT, the India Institute of Technology, arguably the most prominent technology institute in India. And it set off a firestorm, because basically what it argued was that SARS-CoV-2, this virus, we didn't even call it SARS-CoV-2 then, was manufactured in a lab. That's essentially the argument it was making. It turned out that the methodology of the paper was deeply flawed. It turned out the paper was wrong, and the paper was eventually retracted. It would have never made it through a peer review of a major journal. But the damage was done. One of the metrics that we use for seeing how much impact does a paper have is altmetric. Altmetric, it kind of blew up the altmetric servers. It got so much attention so fast that for a little while, it was one of the most visible research papers ever done in history. it quickly died down as as all of its flaws became open and clear. But the point is that there are a lot of upsides to preprints. I believe in preprints and have advocated for them for years, but we should understand that they also come with substantial downsides. And they come with downsides like you can spread really awful misinformation very quickly by putting papers on there that then get attention. And that means to me, as I think about the future of the scientific enterprise, that we need to really think hard about what is the role of publications. And the standard mental model I had in 2019 is probably not the world we are returning to. That life will look different when we think about publications as a dissemination process. It will look different, but we can't completely get rid of the safeguards we've put in place for making sure that nonsense and junk science doesn't become pervasive. And one of the key features of this pandemic has been the sheer amount of, and I use nonsense and junk science, I know that sounds a little harsh, but the sheer amount of junk science that has made it into the medical literature in this pandemic. Not because there aren't really good people trying to produce safeguards. I don't think there've been a few errors that have even made it into the New England Journal and Lancet, and we can talk about those. But the bottom line is, while people like Howard Bauchner, editor-in-chief of the JAMA Network, or Eric Rubin, or other folks are doing a really fantastic job under very difficult circumstances, many journals below them that don't have the set of resources and expertise that the top journals have just can't deal with the barrage of tens of thousands of papers coming in and figuring out what's important and what's not. And that has really, I think, been a huge challenge for the medical publishing industry. And I think the medical publishing industry is going to have to grapple with what does life look like as this pandemic begins to get under control. So that is one, the research enterprise, largely held, but how we share that information, how we get out into the world, the publication process has been changed significantly. All right, second thing I want to talk about is the data enterprise of our country. So one of the key things that I assumed, again, going back to my initial catastrophic calculation and error about where I thought our country was going to land, was I believed that our public health system and our healthcare system was, while it had challenges with data, would largely be able to hold up in terms of being able to track this disease, and really be able to provide a snapshot on what was happening in the country. That also didn't happen, at least not for many months. And even today, 11 months in, now that in the last few months, we've seen real improvements at the CDC, and we can come back to talking about the CDC. But even today, if you want to ask the question, how many people were infected yesterday? How many people were tested yesterday? How many people were hospitalized yesterday? The best source of that information is the COVID-19 tracking project. This is not some government-run program out of the White House. This is a group of journalists essentially volunteering their time, led by a small group at the Atlantic magazine, but a whole set of other journalists. And what they have done is extraordinary. I mean, they deserve, it's hard to know what awards they deserve, but they deserve them all for what they have pulled off. They have essentially created the data infrastructure that has allowed us to track the pandemic. So much so that the White House Coronavirus Task Force relied on the COVID-19 tracking project data for many, many, many months in tracking what was happening with the disease. But the fact that we could not get that to happen through the CDC, the fact that it couldn't happen more broadly through HHS, is a testament to the fact that we did not have the kind of data infrastructure we needed in our country. And even now we struggle. And again, this is not a critique of the CDC, which I believed back in January and still have beliefs remains one of the best public health agencies in the world. But it does show that there were important investments in our data infrastructure that were missing. And as we emerge from this pandemic, we will really need to think about what that data infrastructure looks like. Let me make two more points about data before I move on to talking about a couple of other topics. One is where the data sources come from. So COVID-19 tracking project gets it from states. CDC also now has better data and collects it from states. But when I think about my own evaluation of what's going on with the pandemic, so I'll be speaking to some governor and trying to give advice on what to do on policy. I will look at COVID-19 tracking, I'll look at some CDC data, but I also go to the Open Table website that has data on Open Table reservations by state, by day. I will look at Google mobility tracking data. Why do I do these things? Because these are, again, open source data that tell me a ton about what is happening in the pandemic and how people perceive what is happening. And what this pandemic has raised is that the traditional data sources we think about for public health and medical sciences, the stuff that comes from government agencies, incredibly important, still central, but it needs to be supplemented with what is now massive amounts of data being collected by lots and lots of other folks. And we don't have a strategy for that. And again, if you're going to think about dissemination, if you're going to think about implementation, you need a strategy for data that goes far beyond what our traditional government agencies have been able to manage. And again, this is not a critique of those agencies. We have underinvested as a country. We just haven't made it a priority. So that's what we got to do. Last thing about data, which I think is particularly important, and it builds on something that you heard from Dr. Simpson around racial inequities. So if you've been paying any attention at all to this pandemic, you know that Black Americans, Latinos, Indigenous people have been disproportionately hit hard by this pandemic. The number of infections, the number of deaths, really shocking. Shocking. The question is it surprising? You could argue not surprising, which is what the pandemic has done, is rip the veil from the longstanding issues of systemic racism and deep inequities we have in our society. That is all true, and that all needs addressing. But where I want to link the conversation between what I was talking about and these issues is around data. So it took us months, several months into the pandemic before we became aware of just how bad the disparities in this pandemic were. It took us months. Why did it take us months? Because we weren't collecting data in a way that was useful for understanding disparities. We weren't collecting data in a way that let us understand that Black Americans were dying at 2 to 3 times the rate of white Americans from this pandemic. In fact, back in February and March, a lot of people were saying, oh, the pandemic is going to be the great equalizer. Turned out it wasn't the great equalizer at all. It was the great exacerbator, the great force that took all the existing inequities and made them so much dramatically worse. That's what it did. But we didn't see it for a long time, and we didn't see it because we didn't have the data infrastructure to see it. So when we think about building back to a better system in the future, we are absolutely going to have to think about how do we not just build better data systems, but how do we do it in a way that helps us identify these kinds of disparities much, much earlier so we can act earlier. All right. Let me talk a little bit about synthesis of data. So we've talked about research. Research generates data. There's data collection that needs to happen on the front lines. A key part of insights is around synthesis. So the mental model, again, that I had going back to January, and I apologize, I keep coming back to my mental model of what I got wrong, but I suspect I probably wasn't the only one who got this not quite right, is we have entities that synthesize data. So you do research. I'm a researcher. I write my paper. I get it published in a journal. And what happens next? Well, some of it gets out into the press or maybe goes out other ways. But what happens over time is people start synthesizing all the evidence because no single study gives us all the insights we need on any policy action, right? So the classic thing that will happen is you get synthesizers of data. Who are they? They are often specialty societies in clinical medicine. So when I think about, okay, what's the right way to treat hypercholesterolemia? I'll go to an ACC/AHA guideline, right? Or if I'm thinking about when in diabetes care, do I want to start an ACE inhibitor? I'll go to either a diabetes guideline or an American Society of Nephrology. Again, there are other specialty societies. The point isn't the specific examples. The point is we have relied on these. Why do we rely on them? Why do we rely on the Infectious Disease Society of America? Not only are they expert, though they are that, but also because they are accountable to their members. They are a body that really helps us understand the data, but if they get it wrong, there's a group of people behind them who's going to say, hey, you got it wrong and you got to fix this. I think they have largely done a pretty good job. It's been a little slow, but they have moved reasonably quickly. The other place we often turn is the CDC recommendations, which are data syntheses. And as all of you know, our federal agencies have really struggled in this pandemic. Their ability to synthesize data and put out information has been hampered in large part by political interference in a way that we've never seen before, political appointees changing what the synthesis of the data suggests over and over again. And ultimately, what has happened is that a lot of what has been the sort of synthesizers of data have been public voices, people who have stood up and said, well, here's what the evidence is, here's what the data is. And we can no longer rely on, well, the CDC says this. That's a huge problem for our country if we can't rely on the CDC. I think we will be able to rely on the CDC. I think under a new leadership, Dr. Rochelle Walensky is about as smart and thoughtful a person as I know on these issues. I think we're going to restore some of those issues for the CDC, but we have to think in the future about who are the trusted voices that we turn to for synthesis of information. And let me finish off by taking a couple of minutes to really talk about the issues around dissemination, information, misinformation, disinformation. So misinformation is just misspeaking information, sharing the wrong data, sharing wrong things. What we have seen in this pandemic goes far beyond that. What we have seen is willful misinformation, what people will often call disinformation. This is about cherry picking information done very, very, very deliberately by people to try to cause confusion about what's happening. And it is in the guise of science, right? So all the disinformation about mask wearing and how maybe mask wearing doesn't actually help. All of that is disinformation, well designed to spread and well designed to confuse. Another thing that often is done as a way to try to confuse the public debate is flooding the zone. And this is a very classic tactic of when you are trying to sort out a complicated issue. There are a lot of complex issues in this pandemic. Like issues around immunity, for instance, are very complicated. What constitutes immunity? How good is the immunity? How long does it last? How protective is it? These are tough, important scientific questions that real scientists are grappling with. But the disinformation forces, what they will do is whenever a paper is published on something around immunity, they will flood the zone with tens of thousands or hundreds of thousands, or sometimes millions of Twitter users and Facebook users, all spreading all sorts of misinformation in a way that makes it very, very hard for science to stand out. And that has been a real challenge. And the last but not least is when you have that kind of stuff, you often, actually there are two more points I want to make on this. One is when you have that kind of stuff, one of the things that you do is you turn to trusted institutions. You will turn to say, well, this is a professor from Stanford. And if you have a professor from Stanford, your sort of mental model is that person's not going to engage in disinformation. But the problem is in this pandemic, when things have been as bad as they are, and there are lots and lots of voices, you can always find somebody who is willing to trade on their credentials to share information that I think is deeply wrong. Now, they may be well motivated. They may say, I'm trying to do the right thing. But we have seen spreading of misinformation deliberately. The Great Barrington Declaration, for instance, has this feel of a very well thought out academic proclamation. It's essentially, in my mind, junk science. Junk science is like junk food. It tastes good, but there's no nutritional value. And same way, junk science seems attractive until you think about it. But it actually has no nutritional value. You can't operationalize it. It doesn't teach you anything. It doesn't make the world a better place. And we have seen that peddled by people who come from trusted institutions. It's been really, really harmful. And the last point on this that I want to make, and I'll give you an example, and then I'm going to finish up with where I think we need to go, is the issues around boundaries of debate. One of the things that disinformation experts do, but disinformation spreaders do is they will change the boundaries of the debate. So classic notion here is, there are really important issues that we need to debate about this pandemic, about science, but there are certain debates I don't engage in. For instance, is the earth round or is it flat? Well, there are flat earthers, people who believe the earth is flat, but I don't think that's a debate worth having. I think we just sort of say, the earth is a globe, the earth is round, and we're not having that debate, right? Okay, so we can take certain things and say off the limits of debate because we don't believe that normal, rational people should be debating whether the earth is flat or not. I'm good on that, right? I believe that. What about climate change? Is that still up for debate? Well, I think the science of climate change is now at a point where I don't want to debate whether climate change is happening. It's happening. It's not quite at the level of flat Earth, but it's getting pretty close. But the problem is, the further you move on this, the more you move from like the denialism of there's no climate change, the Earth is flat, to start towards getting into dogma and start getting into an area where we become too rigid in our thinking. So there is somewhere between denial and dogma, this range of space where we need to be able to have debate. So in this pandemic, I don't want to debate whether this pandemic is a hoax. It's not. I don't want to debate whether 1 million doctors and 3 million nurses are in cahoots to lie about how many people actually have COVID. That's not what's happening. What about debates about how much of your economy to keep open and whether you should keep restaurants open if your hospitals are full? My feeling is you should not. But that's a debate, that's a discussion, because there are economic and political and social costs to shutting down our economy, and we should talk through those, and we should talk about the pros and cons. So there's plenty of area for discussion and debate that has been happening, but the disinformation people always like to spread the topic so that they get into absurd conversations, and then what they're arguing seems no longer so absurd. And we have to be very careful about that. Last example of this is a personal example that I want to raise, and then I will really wrap up here, is on November 19th, Senator Ron Johnson of Wisconsin held a hearing about hydroxychloroquine. It was guised as a hearing about early treatment for COVID. A hearing about early treatment for COVID is a really important topic. Homeland Security is the chair, he's a chair of that. And what he did was he brought in 3 people who proceeded to spend time arguing, essentially, if you listen to their argument, that hydroxychloroquine was this miracle drug, saved lives, but that the entire medical community, the FDA, the CDC, all the specialty societies, the NIH, were in cahoots to deny the American people this life-saving drug. It's absurd. It's bizarre. That was the conversation. And as I was the one speaker on the quote unquote other side arguing for science evidence and saying things like the IDSA is doing it right. The NIH has funded these studies. The FDA has looked at the data. The scientific enterprise is largely intact. And what I realized going through that process and the days and weeks of kind of harassment that followed is that these campaigns are very, very well designed. And the hydroxychloroquine campaign landed in the Senate as a victory. And for weeks, we were all talking about hydroxychloroquine again, in the middle of a surge where we need to be focused on protecting lives and getting vaccines out. So how do we move forward in all of this? And again, we'll talk more about this in the discussion. I do think we need to make real investments in our data infrastructure, which I think has been wholly inadequate. I do think we need to think about alternative sources of data and how we work those in. I think, as I have said, the publishing industry needs to rethink its business model and its strategy. Preprints are here to stay. They will be with us forever. And we have to think about how we bring a certain level of rigor and quality to the data that gets out from preprints without slowing down the process too much. So there is a trade-off of speed and accuracy. In the middle of a health crisis, you can push towards speed, but as a health crisis wanes, we have to pull back a bit more towards accuracy. I think that's going to be very, very important. And then last but not least is we have to think about who the trusted voices are for information dissemination and how we build up those voices and how we augment those voices. Because it can't just simply be that the voices are the federal agencies. And again, I'm a big believer in both the CDC and the FDA. For my entire career, saying the CDC says was a shorthand for the best evidence says. Or if I said the FDA has made this decision, that was a shorthand for this is where the science is. That has been pushed, that has been kind of, that's been dented a little bit. Hasn't been broken, but it's been dented. We've got to restore that. But we also have to realize we live in a different world where information disseminates in very, very different ways and not through the traditional models. So as we end this year, let's reflect on what has gone wrong. Certainly let us reflect on what has gone right. And then as we get into 2021, let's think about how we build a scientific enterprise that that disseminates information more effectively, quickly, but with more integrity, and how we can make sure that really high quality information is implemented into our policies. Again, thank you. I went a little over than I was expecting, but I think we still have plenty of time for questions. And again, big thanks to David and Lisa for inviting me to this. I really am grateful. Thank you.
So thanks to some sort of magic, I can see that the 889 participants are all clapping, applauding, but unfortunately it's not as audible as it would be if we were all in the same room, but wonderful comments. Also wonderful just to see the steady stream of your perspectives within the chat. We've seen a few different questions. And of course we have the Q&A opportunity. And some of you have already jumped in, you've submitted some questions. You've also been able to sort of upvote various questions. And so we want to make sure that we get to as many as we can within the next 20 minutes. I wanted to ask an initial question, Ashish, and amazing comments. I was curious, so we have this large audience who is really committed to trying to advance our understanding of how we better disseminate our evidence, how we understand how to integrate the range of different evidence-based interventions into various practices, into clinical and community settings, into policy arena. What advice do you have for this community as for how they might know they want to help? There's a lot of interest in trying to make for a better end of the year and new year. What advice do you have as far as either the kinds of topics to concentrate on or just ways to be involved?
Yeah. Well, let me start off saying a couple of things. I mean, first of all, one of the things I learned early in my career as a researcher was that people who have to make decisions want to get things right. Whether that's the policymaker in Washington, or it's the hospital CEO, or it's the clinic practice manager, they do want to get it right. And our job is not to be dogmatic about, oh, there's no randomized trial, therefore we don't know what the right answer is. No. It is to understand that evidence comes on a spectrum. And that with lower quality evidence, just evidence that's not as robust, no knock on the evidence, comes more possibility of error. And a key part of how to think about turning evidence into action is communicating what you know, what you don't know, where your boundaries are. So for instance, I've had in this 9 months, lots of conversations with governors and health secretaries where they'll say, what should I do on X? And I'll start with, I don't know. I would not say I don't know. I'll say, I don't have the evidence. We don't have the evidence. It doesn't exist. Or the evidence here is weak. Now that you know that, let me tell you my best read of the evidence we do have, and understand that I have larger error bars because I don't have strong evidence. So I think finding ways of turning the evidence you do have into action is critical. Obviously, there are going to be so many issues to work on. But what I want all of you to do is first be really good consumers of evidence, understand what is high quality and low quality. And second, don't be afraid to use lower quality evidence if that's all we have, but communicate effectively, that's what we have. Low quality evidence is still better often than no evidence at all. It's just that we don't have as much. And then last point, one of the things I often say is use every opportunity to generate better evidence. So you implement a policy, the evidence base is not awesome, it's okay, but use that implementation to learn so that you can do it better next time and other people can do it better next time.
Gotcha, thanks for that. So just seeing where we are in terms of our ranking of different questions, I'm going to start with the one right at the top. And so it asks, in research, what are other innovative means of dissemination beyond the manuscripts and conferences that we're engaged in, as those are mainly accessible to researchers and not necessarily the individuals or communities that we work with?
Yeah, it's a very good question. You know, I have often thought that like publication in journals and conferences, obviously very, very important, serve a bit of a different purpose. I mean, yes, they're a way to get the information out to lots of people. But over the years, for instance, I spent a lot of time in Washington with policy people, and I built up a set of relationships. And you can do this with community organizations you work with. So the model works. What I would say to these folks is, if you ever read a paper of mine in a journal that you think is interesting and you're seeing it for the first time, I screwed up. Like, my job is, as soon as I am comfortable that the analysis is right, I share that information with people who could use it, right? Because they need to see the data often much earlier than we can get it published. It's a way to engage with people. So we would often, like, we'd make sure we got the analysis right, and then I ship it off to some colleagues at MedPAC, or I'd send it to somebody on the CBO, or I'd send it to somebody at HHS and say, here's some analysis that you might find interesting. And it would allow for a discussion for them to become more enriched. And, you know, and you could, if they're not interested, they won't write you back, and then you can stop harassing them. But the point is, share your results early. And if you do it in a way that's, you're not putting it on a website and doing a news conference, journals generally don't get that upset about it. And so if you have community organizations you work with, if you have other people you work with, share your results early. Talk to them about what it means. And don't just send them a bunch of tables and figures and say, here you go. Say, hey, by the way, we've done some work that we think is important for what you're trying to accomplish. Here it is. Do you want to get together and talk about it? Or, you know, and I can walk you through why this is important to you. Be willing to engage proactively in those kinds of things.
Yes, wonderful question. An alarm
Sorry,
went off.
I stopped just as you were grabbing. So
yeah,
please,
no, it's perfect timing. My alarm to take my dog out went out. So everyone remember that one. So want to go to the next question. We know that the best messengers are often those who have an established, trusting relationship with the receivers, but most academics and researchers don't have those established, trusted relationships with communities, and instead are met with skepticism and distrust. How can academics and researchers who have relevant expertise work with others who are trusted and established in the public sphere to get accurate information out there?
Yeah, it's a fabulous question. And it's exactly the right question. So there are two parts of that question in my mind. One is, as an academic and as a researcher, how can you establish some level of trust yourself? And then second, how do you recognize that whatever you're able to establish in the short run, ultimately the biggest impact are going to come from people who have long-standing roots in communities, who are trusted much more deeply. And I think it requires, it's both, right? So let's talk about how you make yourself a more trusted voice. And I've gotten plenty wrong. So this is not like, I'm not saying I'm the model, but I've learned some things and it begins with a few things. I mean, the single biggest thing is humility. I am not the expert, like the world leading expert on almost anything. So a lot of it is about humility, understanding where the science is, where it isn't. A lot of it is like being comfortable saying no. I've had lots of call-in shows on NPR and PBS where I get asked a question and I know there is an answer. I just don't know that answer. And I don't try to fudge it. I don't try to bluff my way through it. I will say, like I remember once getting asked about COVID and pregnancy, and I knew there was a paper out, I just hadn't read it yet. And so I said, there's some important work here, but I don't know it. And I'm not gonna try to, So I think that kind of openness, honesty, knowing your limitations, channeling other people. So in this pandemic, there's so many really complex issues. When I think about issues of virology, and like you always see, oh, is this a new strain of the virus? I get asked that all the time. There's a new strain. I'm not a virologist. The issues around viral strains are actually quite complex. They're not just like, oh, there's a genetic mutation. There's a mutation of those things happen all the time. What constitutes a strain? So I will not try to become a virology expert. What I will do is I will channel someone like an Angie Rasmussen. Dr. Rasmussen is a virologist. I was gonna say at Columbia. She just recently left Columbia, but she's brilliant. And she is one of the leading virologists in the world. So part of communicating is knowing who the true experts are. And then let me just make the other part, which is it is really important to build trusted relationships with people in communities, whether they're local public health or medical leaders, but they also can be leaders, religious leaders, leaders of faith-based groups, other community groups, and engaging with them and talking to them and enabling them, because they may not have the same expertise, but they care deeply, they know a lot, they're smart people. By the way, never, ever, ever confuse expertise with intelligence. This is something that experts do a lot, and there's nothing more offensive. So like, they're really smart people who just don't have your expertise. So explain it to them. If you're willing to do these kinds of things, I think you really can become a force for good information out there.
So I know that throughout your comments, you've talked about how particular communities, populations have been hit particularly hard. And the next question, I think, adds to where there's often multiple characteristics of a population that may make it even harder for those folks to get what they need. So the question is, how can we confront the impact of ableism and racism in people who are disabled in underrepresented minority groups? I think there is such an opportunity to confront ableism in D&I and how we support individuals with disabilities. Any thoughts on that?
Yeah, it's a really good question. And it's complex, right? Because there isn't a simple answer like we should just do this. I think, first of all, it does begin to some extent by just acknowledging. I mean, I think we've gotten much better as a society in acknowledging the deep-seated issues around race and racism in our country. Again, I'm not suggesting that even that is anyway done, but issues around ableism rarely come up. I think we have not spent enough time thinking about that. And I think beginning to engage on them, beginning to, again, engage with experts who are really well-versed in this is important. My kind of general approach as I approach any of these kinds of things is to understand my own limitations and then seeking out people who have far more expertise on that and understanding from them. So for the person who asked if this is an area you've been really passionate about or know about, like, we should find opportunities for you to teach us what else we can be doing. But I think even little things like when we put closed caption on events like this, it's just a reminder that for some people that's an important way to engage, and we want to be open and inclusive, and we want to bring everybody into this conversation, because that's how we move forward as a country and as a society.
Yeah, thanks for that. So I think one consistent theme that I'm seeing in the chat and in some of the questions is just how appreciative everyone is for you recognizing, which I think is often hard for people, that we're not perfect. We don't always get things right. And you talked a little bit about some of the misassumptions that you made. And I wonder are there other things, other sort of epiphanies that you've had as your thinking has evolved and continues to evolve over this time period that you might want to share with us?
Yeah. I mean, there've been so many. I feel like this entire conversation was framed around, let me tell you everything I got wrong about the pandemic. But there are other important, I think, insights that I have had that maybe I didn't have enough of a chance to lay out. Let me share one around misinformation. So I did spend a bunch of time talking about disinformation. And I have to say that it caught me totally off guard. Starting in mid-March, I started responding to media calls and talking to people. And I really saw it as a short-term thing, like I'll do some media, I'll talk to some people. And I just assumed that at some point this would stop. And what happened as time went along was there was this kind of constant stream of need. And I continued. And I realized at some point, and it's probably around May, and it'll be very interesting as we again dissect the timeline of this pandemic, that the pushback I was getting changed. Instead of like the individual person asking, well, what do you mean by that, or pushing back, or some personal attack, what I started getting was concerted attacks on what I was saying. So I'll give you an example. I remember there was a paper that came out about the seroprevalence of COVID in Spain. It was a paper in Lancet. It was a really well done antibody study, and essentially it suggested that about 6 or 7% of the Spanish population had been infected by that time. And so on Twitter, I did what I do often, which is I read the paper and then I laid out the main points and I said, here are the major implications. and posted it. And within about an hour, maybe there were 500 responses, almost all of them saying identical things about the seroprevalence study, and almost all of them basically saying, like talking about T-cell immunity and how the study failed to look at T-cell immunity. And if you clicked on the people, they were like, there was some random finance guy in Laredo, Texas. I'm like, what does he know about T-cell immunity? I barely understand T-cell immunity. And I feel like, I've been studying this stuff for a long time. The point was, it wasn't that the Laredo, Texas guy knew a lot about T-cell immunity, that this was a concerted campaign. It wasn't random that 500 people responded to my tweets talking about T-cell immunity. It was meant to spread disinformation. These things are very well orchestrated. I had no idea such stuff existed. I've certainly gotten much better at understanding them. These are not just people, this is not just Uncle Bill sharing a video of something that's wrong. These are well-designed campaigns. And we don't, as public health people, we have no tools for how to counter it. And we've got to develop those tools.
And I see a related question is just anything you think that we could do. There's this huge challenge that within our country, within other countries, there may be people who are using completely different information sources. What's the way to try and maybe move more in a direction where there's a common set of information that everyone can digest?
Yeah. So this is a big issue, is that we have totally different information bubbles. And there are people, good-hearted people, smart people who believe that COVID is largely a hoax, that it has been implemented to try to bring down our president, and that the hospitals are empty, and all sorts of things that we know to be not true. So how do smart, good people, because believe those things, not, again, they're good people, they're smart people, like don't begin with they're dumb or they don't care. They live in a very different information architecture than we live in. And that is one of the biggest threats to our society, one of the biggest threats to our democracy. My personal take is that we need a multi-pronged approach to this. One, certainly, is about reaching out to people who live in different information bubbles. So I have always been willing to go on Fox News, or this past weekend I was on Newsmax. I was reaching out to a different audience and trying to connect with people who you don't generally connect with is, I think, very, very important. And I think it's an obligation that we all have. I also think there are important obligations of media companies, social media companies like Facebook, to not continue to spread misinformation. And I think some have done better work on that than others. I think Facebook has done not nearly enough on this topic. But ultimately, a functioning democracy requires not that everybody have the same values, but that everybody begin with the same book of facts of what is true and what is not. And when we don't have that, it is much, much harder to fight a pandemic. It is much, much harder to have an effective democracy. And I think that comes from outreach and from connecting with people who are not part of your information bubble. And if you're not doing that enough, and I'm probably not doing that enough, then you need to make more of an effort to do it.
Thanks for that. So I wanted to get in just a couple more quick questions before we run out of our allotted time. So a lot of discussion about how science may have changed as a result of this. And I see right at the top of the set of questions, people wanting to know if you can comment on what you think will happen with open access to articles on COVID. Has it been helpful? Do you think this kind of thing will broaden and continue over time?
Yeah, I think a lot of things have changed in the pandemic and we're not going back. So I don't see open access for critical stuff turning around. I think it's going to pose some real challenges for journals, for whom, look, there are two issues, right? Like there are people who just believe everything should be open. Well, it turns out that we do want people to be gatekeepers. We do want that study that suggested that the COVID was, SARS-CoV-2 was concocted in a lab. We don't want papers like that published because they're junk. And you need somebody to filter it. You need to process. That's what journals do. So we have to find ways of making journals financially sustainable. That said, it's very, very hard to put a genie back in the bottle. And open access has become so prevalent that we're not going to be able to find easy ways of getting that back in. So I don't know what the next model is going to be. I worry if everything becomes only open access, that there will be no real possibility and no real mechanism for sorting out what's junk science from what's real science. So we need to continue to be able to do that. And maybe it is through a paid model where everything is open access, but people pay for publications. That has all sorts of its own issues of who's paying and what about authors from poorer places and can they publish? So there are complex issues that we got to go through. But what I can promise you is we're not returning to 2019.
Yeah. So obviously we've talked through a lot of the challenges, things that didn't go as well as we, of course, would have liked. And I just wonder, if you look ahead, what gives you optimism as we finish this particular year that some would not want to, most would not want to repeat. But as we look ahead, what are you optimistic about?
I tell you, David, so much optimism, despite coming off of a horrendous year. Let me tell you a few things that have just been huge home runs. The entire scientific enterprise. 12 months ago, no one on this call had heard of SARS-CoV-2. We didn't know about COVID-19. The virus was first identified in mid-January. And before mid-December, the first person got a vaccine outside of a clinical trial. Like, how crazy is that? It didn't happen because of one or two people. It was a phenomenal collaborative effort. You know, one of the more frustrating things is somebody was last week was saying, oh, this is a great American vaccine. America had a very big role in these vaccines, no doubt about it. But the Pfizer vaccine was developed by two Turkish immigrants living in Germany. And when I think about the virus, that, you know, it was sequenced and put on the web by a Chinese scientist. And 2 days later, a German scientist had created a test for that virus. And 3 days later, a South Korean company had then turned that test into something they could produce and start getting out. That's science in its most wonderful globalism. Globalism has some challenges, but science is inherently global. And if we ever wanted to see the benefit of a global scientific community, 2020 is your poster year. So we want to think about how we preserve that and how we augment that. Again, I think there has been a lot of coming together, even though this virus in many ways has also torn us apart. I think we want to build on this year. I think we want to talk about everything that worked, and then let's look at these hard issues and build on how we get better. I am very optimistic that much of the world is going to be ready for that. It's going to be willing. We're going to see much bigger investments in public health, in data, because we have learned the cost of not doing it. So I guess I wish we didn't have to learn the lessons the way we have, but I am very optimistic about 21 and 22 and the years that follow. But we all have to do our part to get us there.
And perhaps the same amazing timeline around discovery will lead to a sort of similar timeline around the dissemination and implementation of those discoveries. Yeah,
absolutely. And let me maybe finish there, right? Is that the scientific enterprise, as somebody said, the scientists have done their job. One group of scientists, the biomedical scientists, but now there's a whole science of how do we get 6 billion people vaccinated. I am actually pretty confident, David, that group of scientists that are going to help us get 6 billion people vaccinated is going to perform every bit as admirably as the scientists who cooked up these terrific vaccines. I shouldn't say cooked up, but basically who created these terrific vaccines in labs and things. It's both parts of the scientific enterprise that I have a lot of faith in.
Well, thank you for that. And again, to say thank you to the amazing chat and the wonderful questions. I know we didn't have a chance to get to all of them and wish that we could, but hopefully the conversations will continue in all formats, starting with a bit of a break and then your concurrent sessions. Please, again, join me. Ashish, what a wonderful way to kick off our meeting. And thanks so much for spending your time with us.
My pleasure. Thank you for having me on.